Saitolulasuukutngaartuutislutaayuinatu.
Musviskailam taksinnikkaartaunanisu pittaunani ilumun tamaatu seknasamtuttaaqaatag yuqtoaye nasuunaunani tangasqatimakut pillortaan siunerqarlukuttoya mannapini nankan nunaamun taqsartarqattoquu piunerqalun anertuutailami
Chimingilrehuatsat everything new now. My people changed too.
When they came to us villages, everybody was like cattle. You go in, you get your shots, you go in, get your teeth worked on, get some x-rays, because TB was rampant back then. They wanted us to be like they were, and we dressed like them, and that was odd and different and everything, so a lot of traumatic change. But we wanted to be policy makers and help form our destiny.
I see the bigger picture in self-determination of tribes in general and the history and the formation of the health corporation. You know, the entire Alaska tribal health system is based on the formation of BBAHC. BBAHC was the first tribal hospital to assume healthcare from the Indian Health Service and create a corporation to provide that service to the people of the region. That was 50 years ago. At the time, our tribe was very instrumental in the formation of the corporation and assuming those services from IHS. Today, that's still true. It just looks a lot different than it did 50 years ago.
Bristol Bay Area Health Corporation started right in the city of Dillingham in a home. They bought the home, I think a 5-bedroom home, turned every bedroom into an office, and they outgrew that little building and moved to where they are now. And since 1974, the health corporation has blossomed.
We started off with 3 employees, $40,000, and a dream to take our healthcare into our own hands.
It does say a lot that our people are running our healthcare. The ability to have our own governance structure over our healthcare is really amazing.
I'm a firm believer in all of our traditional cultures as an avenue for wellness.
Culture and traditions are healing because it's who we are as people. And we are healing. We have culture, we have our traditions, we have our teachings, we have our elders, we have our kids that are teaching us, and we provide different tools for people to continue on that path for healing.
Some of the cultural aspects that we can use, like native dancing and native arts, can be very helpful as a mental health tool.
We have a prevention program as well as a treatment program, and we were offered a very small grant, and that little seed money allowed us to bring in some facilitators to do culturally relevant group work, and people were feeling very proud of things that they were able to do and that maybe they learned when they were a child, and then as they got further into their substance use stopped doing. That helped to build like their sense of identity. It helped to build self-confidence, and we just saw an excitement in them.
I think that our traditional cultures have harm reduction and peer support and compassion and intelligence all built into them. So I see the pathway to wellness being through implementing our cultural ways of doing things into every aspect of our healthcare. As a people, we have experienced a lot of trauma in the medical field. We have relatives who sometimes feel like they haven't been heard, they haven't been cared for. It's a really important part of sovereignty that we are able to get services in our own communities and that we're able to make decisions about how those services are provided.
The biggest change in healthcare delivery in rural Alaska has been the health aid program.
You know, there was no clinics in these villages really, but in somebody's home where somebody took over the job of being a health giver, and they talked to the hospital, and they had a regular radio schedule, and everybody in the country knew what was wrong with everybody in the next village. There's no privacy, you know.
We talked to the health aides with what they called AM radios, which were on fishing boats. And then they take them off the fishing boats and take them to the homes.
I was a health aide. I saw Matt, Nick, and his mom. But we worked for free, no pay. Finally, in seemed like late 70s, we got $700 a month. Big pay. The concept of community health aid programs started in Anchorage for a need for healthcare providers. But the healthcare providers had to be homegrown from their village. And all over Alaska, that concept of providing healthcare providers everywhere in rural Alaska started.
Here you have a registration department, you have a pharmacy department, you have a lab department, you have other different supporting departments here. And when you go out to the village, you are all of that. So whether dental's going, optometry, they're assisting all of those other departments in the community, along with patient care, plus being on call 24 hours.
There's some people that are made to health aid and some that aren't. Probably the most important thing is knowing the people you serve.
In order for us to be healthy human beings, we have to have that connection to our clinics. We have to have access to regular care.
Clinic Mikelingutang Kakai. Yeah, today they got new everything. Automatic everything. When they x-ray my leg too last week, I really itching. Inside the clinic, x-ray my leg.
We're trying to modernize and have done quite a bit. We've got state-of-the-art equipment.
One of the important parts is for us to reconnect with our community, whether it's in our villages, our Dillingham community, as well as our community here in the hospital. Making sure that we treat our employees well. What do they need to grow and prosper? What do our patients need to grow and prosper? We're looking at working with our patients and getting new equipment.
And technology has changed drastically. And so we kind of looked at this concept that every clinic in our region has the same piece of equipment, and I have the cart here. Why not, instead of moving patients, move information? And so the telehealth aspect, we have seen from these old carts to this cutting edge, two-way communication with Zoom capabilities, and you can scan, and the technology has allowed the patient and the provider to interact in a way they've never been able to do before. Even though telehealth prior to COVID, we weren't getting reimbursed, it was a service to the patients of our region. Little old BBAHC was the model that the rest of the nation ended up going back and using.
We're creating new programs, new innovations to be more effective, patient-centered, to have high quality outcomes for people's health. We've added some programs that need some physical modification. So I think down the road, you'll see a very innovative campus that's meeting the needs of our patients and our community.
It's amazing that we're broaching our 50 years. Who would have thought we would be around that long and do what we're doing?
The level of healing that we could experience together is immeasurable, and I think what that takes is unity.
If you work together, it's just so much better and easier. And while we may have differences, we need to work together. That's what healthcare is all about, trust and a relationship. Trying to really understand the native language and ways we do things.
I think wellness is when we're able to shape our own experience within the healthcare system to honor our Indigenous values and to experience true safety.
Looking to the future, now that we've gone through 50 years, we want our kids to be aware of our culture, of caring for all our people, and we're working for the health of our people, not just today, but in the many, many years to come.